Thank you, Nadine. That's a true story, actually. We met on the lawn in Dana Point and started the conversation, and here we are today. It's a real pleasure to kick the meeting off. I want to welcome everybody. For those that were here last night, welcome back. For those that are just getting here today, welcome. It's a pleasure to have on stage with me Bernd Montag, CEO of Siemens Healthineers. When we prepared this meeting, we wanted to kick the session off. We have a couple days full of innovation, as Nadine has pointed out, investment, strategics, but we really wanted to kick the session off with a talk of hope and inspiration. And I thought of one of the CEOs that has really built a culture of innovation at one of the major strategics. So please, let's give Bernd a warm welcome and a round of applause.
Thank you.
So I'm going to pull my notes out here, just in case.
Oh. And I do it too.
Yes, you do it too. Nadine did a great job of capturing why we're here, but just to point something out that I thought was interesting from last night, we had Antoine Papernik from Sofinova on stage, and we were debating about what the assets under management were, and it was quoted $6 billion, and then he corrected it 2.5 billion. So last night in my room, I was going through the sheets, and I looked at the 100 presenting companies that we have here, and it turns out that these 100 presenting companies in aggregate are raising about 2.5 billion. So if Sofinova wants to come in and take care of all of them, I think we have a really nice fund that's been created here. So if you see Antoine, you can come back to him and let him know that we have a solution to his problem. So we're here to innovate over the course of the next 2 days. We're here to inspire. We're here, as Nadine points out, to advance healthcare. So I thought I'd like to give a quick background on Siemens. We all know Siemens Healthineers. And then I'd like to ask Bernd how he ended up here. So just a quick summary. In 2018, Siemens Healthineers was spun out of Siemens. So they're young but old. Maybe we'll talk about that a little bit. Okay, $50 billion market cap. They're the 11th largest German company on the German stock exchange, one rung below Bayer and just above BMW. Bernd has been with them and led them through the Varian acquisition, a very interesting Corindus acquisition, and has taken his large organization successfully through COVID. So before we get back to Siemens and the technology and the innovation, Bernd, how did you get here?
By invitation. No, I mean, getting into Medtech was more love at first sight, and not an arranged marriage. Yeah, so it happened, but I really fell in love with it after I graduated from university as a theoretical physicist, yeah, which sounds very smart, but is very useless. Yeah, and being part of this world of this communication between, we heard about the necessity of innovation. Yeah, so the necessity of innovation which comes from the communication of physicians with people focused around technology. Yeah? There's two different worlds coming together. I think this is an absolutely fascinating field, and I'm very happy that I could build my professional life in this field.
Thank you. And you have an interesting background before the professional life. I think many of you may know that you were a professional athlete, and maybe down the road in the conversation you can talk about how some of the learnings from being an athlete has correlated over into your life as a leader here. Okay. We had an interesting chat last night, a brief but interesting chat, and you had described for me what I think would be interesting to frame up this conversation here, but you talked about sort of 3 categories of companies and where you see Siemens fitting in. Maybe you could share how you view that structure.
Yeah, and this is a bit of a topic where I also am happy to receive help how to best call the categories. And that I have this picture basically since the IPO when we needed to really explain who we are and where we are basically a company without real peers. Yeah. So and the three buckets, I would say, when it comes to who are the companies making healthcare providers, helping healthcare providers, supplying to healthcare providers, it's pharma, it's Medtech in the device sense. Yeah. Like when you look at big companies like a Medtronic or Boston Scientific or so, and then there's us. Yeah. And what is the big difference? I think that when it comes to a stent, a pacemaker, and so on, yeah, in Medtech in that sense, it is more similar from a business model point of view to pharma. Yeah, it's like, but it's metal, so to say, or technology. But the model is you want to have that thing in one patient, yeah, and you work through the healthcare system to be successful, yeah, to make sure that this one procedure is done in a patient. What we do with our capabilities, yeah, with diagnostics, imaging, interventional workplaces, radiation therapy, and so on, is making, and digitalization and AI is making the healthcare system in total more intelligent, more efficient, and from the investment in this smart infrastructure, then many, many patients benefit. Yeah, and it makes possible the right diagnosis, which then makes the delivery of the right drug possible, or it helps guiding the intervention which puts in this device, yeah, or it helps to find out whether a drug has really worked and so on. Yeah, so this third bucket is the bucket we are in. Yeah, I don't know what is a super good name for it. Yeah, but I know only that in this third bucket we are the biggest company, and that it's very. It's great for us to be so much in the middle of things, yeah, because we see what all the innovations coming from the device companies, coming from the pharma industry, because in the end, they all cross our systems in a way.
Very good. And reflecting back, obviously the Varian acquisition was a major milestone in the industry. The Corindus acquisition, I think, was something that was raised interest, and then there's a couple other acquisitions you've done in sort of the digital space. Can you tell us a little bit about what we may see down the road, or the strategy behind those acquisitions?
So I hope I don't sound too nerdy. Yeah? So when I paint a picture of, let's say, the hypothesis of what Siemens Healthineers is built on, but where I see medicine going, then it also comes to the very important aspect of how do we scale medicine and make it independent from just the availability of a super smart physician. Yeah? I paint a triangle of something I call patient twinning, precision therapy, and digital and AI. Yeah? And what I mean by it is, with patient twinning, yeah, which is a bit of a provoking term, it's like we try to create a digital copy of the individual patient, meaning with imaging, with lab diagnostics, you basically have a model in the long run, yeah, from which you can make the right diagnosis, select the therapy, potentially can simulate the therapy, but then can also help perform the therapy. It's like you do a Google Maps of the patient. That's one corner. The second corner is the precision therapy, which is like the pencil beam of a Linux, yeah, or the endovascular robot, yeah, which is using the information of the twin, so to say, to guide these super precise treatments. And here the world innovates for us, yeah, also the device industry, the pharma industry, and so on, to guide these treatments at the right place in position. And then as a third corner, it's digitalization and AI, which augments the two others, yeah, but also makes this super vital connection. And that's basically the story also behind the Varian and Corindus acquisition. It's like, how do you connect imaging, the mapping, with the delivery of therapy and make both better with this combination. Yeah?
Very good. One of the big themes that we'll see in this meeting are a lot of the subjects that you're talking about, digital, AI, data, et cetera. How far away are we from, how much work do we have to do? This vision that you've laid out, how close are we?
See, I like this word, the future is already there, it is just unevenly distributed. Yeah? Because in many cases, a lot of it is there. Yeah? We have today, when you look at, for example, treatment planning, yeah, we have an AI algorithm for the super important aspect of sparing healthy tissue, yeah, in radiation therapy, where you have an AI algorithm which automatically segments all the organs, yeah, and then makes sure, yeah, that the mission critical organs can be spared in the radiation therapy treatment, and that it's not that you don't need a physician who is trained for decades to do something, yeah, and still half an hour of his or her time to draw the contours of an organ. Yeah? And so I think we are very, in many topics, this is already, this is happening. Yeah? Mm-hmm. And now we need to work our way up. Yeah? But it's always, I think, a crawl, walk, run approach, and not this big, I'm tempted to say IBM Watson type of dream to solve everything in one go. Yeah?
Okay, so let's get specific. And I brought this question up last night, and I sense you may surprise me, maybe not. What's the biggest, in your mind, the number one challenge that we have in healthcare? What's the one thing, if you were to pick, that Siemens is going after now?
So I'm cheating now and say there are three number one things. Yeah?
Okay, we'll work through it.
So, but I think they all are super important. In the end, I can make the excuse. You know, they are connected. They are all one. You know, I think one topic is staff shortage. Yeah, we have we have more and more patients, less and less qualified staff, and we need to look at it as, again, necessity is the mother of innovation. This is a super big source of innovation. Yeah? How can we deliver better medicine without having to rely on more people? And there's also the discussion, the public discussion, I think, and when it comes to the future of the NHS in this country. Yeah? So this is one topic. Second topic, there are 3 billion people worldwide who don't have access to healthcare in the form as we are privileged to have it. Again, what does it mean when talking about innovation? We should never, and that's something super important in Siemens Healthineers also, that innovation has always two directions. One is make possible what hasn't been possible before, yeah? Push the boundary. But the other direction is how do you democratize what you have done already? Yeah? How do you make it more accessible, easier to implement, lower the cost of adoption, and so on and so on. Yeah? So this is a big topic also. And the third topic, so I'm cheating as it is, the pandemic of cancer. I think what we learned in COVID is, COVID is a horrible disease. Yeah? But what we tend to forget is that every year 2 times more people die of cancer compared to what happened in COVID. Yeah? I mean, it's a bit cynical to compare, yeah? But it's a pandemic we got used to, mm-hmm. Yeah? And which is so far here to stay. Yeah? So what do we do about this? Yeah? And for Siemens Healthineers, it means how can we apply the triangle which I talked about, to this very complicated disease.
So that's
so pick one.
So let's stick with the last one for a moment. One of the stated objectives of this meeting, obviously, we have all the pieces here at this meeting. We have the innovators, we have investors, we have the big strategics that can help take these companies after they're financed, they're hitting milestones, and get them out to market. We, in fact, have some companies that are working on early detection of cancer and various technologies that would potentially be of interest, I believe, to a company like Siemens. So you were recently quoted in an article in reference to a discussion about some challenges with NHS, that we can't just throw money at the problem, we have to really throw innovation and technology to solve these problems. So what is the Siemens approach for innovation? Is it internal, external? I'm sure it's a combination of both, but if you're an innovator here, or you're an investor that would really like to get closer to Siemens, each organization has their own culture of acquiring new technology. If I'm a company here and I have a story I want to share with you, how do I connect with Siemens? Loaded question. A friend asked me to ask.
I'm smiling.
Yeah.
Because people are saying, "Oh, you are complicated," but we are complicated for a reason. But I know. But I mean, coming back to the main question. I mean, you heard me talk in the very beginning. I mean, what I find fascinating in this field, this eternal dialogue between the physician and the engineer and physicist, about what is needed and what is possible, and this exchange. And I think there is no product, no innovation in Siemens Healthineers which is not the result of a clinical collaboration, of working closely with the leaders, especially in academic medicine. So our traditional and still most important innovation model is working with the leaders in the field, to make technologies better. Now, in our world, there is something special about this, and because there is almost a trained group of subspecialty physicians, the radiologist, the radiation therapist, the lab in lab medicine, or the cardiologist, whose raison d'être is more or less to use the equipment we built. So, and then this dialogue is, so to say, very, very a natural thing to happen. But now we need to think broader also. And this is where the smaller companies and so on come into play. In our case, it is not as much as it is in the, let's say, in the device industry, where you can say, here's an independent piece of innovation which you can plug in to the big Medtronic and Boston Scientific or so, who have a huge, let's say, apparatus, with all respect, to sell and to organize clinical trials and so on, because in our world, it needs to be connected to the other technologies. So it's an application on top of the CT scanner or so, but it is not something which can stay independent. It needs to be technologically integrated into what we are doing. And that is why when talking to us, it is important to find the right group. And to some extent, we are a campus as Siemens Healthineers with 6,000 or 8,000 engineers, to find the right group in the right field, and there's not a central innovation department. I mean, when people talk to us, we can route them to the right people, but in the end, it is engaging with the people who are working on the exact same field.
Okay, that's a good transition into people. This theme continues. It comes throughout every event we have. It came up last night, and now you're bringing it up, and you're managing a huge organization. We're trying to innovate, and you have a massive organization with a lot of people. In 2020, with the Varian acquisition, I think one of the sensitivities, or one of the things that you were very conscious of going into it, is that you didn't want to have the big company swallowing up the little company. You wanted to maintain the culture, the varying culture. Then we have COVID. Now we're working remotely. And I did my due diligence on you and spoke with many of your employees. And I'm going to list a few words here that people used to describe you when they talked about your leadership style.
Were they allowed to talk to?
Yeah, I won't tell you the source of these people. These are the words that were described for you, again, with reference to post-variant, post-COVID, where are we today, okay? Coach, leader, sarcastic sense of humor. We haven't seen any of that yet. Humble,
That's
tough.
a good combination.
But the ones that came up over and over were authentic and inspiring. So you have this huge organization that you're trying to inspire. We have this event with 450 people here, a couple thousand that are streaming in. We're all trying to inspire our people. So talk a little bit about how you created this culture for both innovation but inspiration. What are some of the things that you did?
Yeah, I mean, thank you for the compliments. Thank you for filtering out these comments. See, I think what is important is, I mean, I'm not a big fan of this word leader. Yeah, this is a bit of a glorified term. Yeah, but when it comes to showing what's possible, yeah, and connecting it to the bigger, to a little bit of the bigger picture, yeah, because I think the privilege of being the CEO is that you can see more. Yeah, I always say I see more, but not because I claim to be smarter, but because I have the job. Yeah, so you can connect things, you can see, and then you can give back, yeah, to those who are more deep than broad, yeah, in the CM. And I have the privilege, I can be here, talk to inspiring people. I was at the UN General Assembly yesterday and the day before, and talk to African presidents and so on. But I can give back to what I talked about this with the president of Kenya about cancer care. Yeah. And I think this context setting is super important. Yeah. And I think especially in this field, which is so inspiring, yeah, to see this context and to not get lost. We need to finish the software version by end of December, or well, I'm not happy with them. So I think this constantly reminding ourselves of the unique purpose we have. Yeah. And I think there's a second topic, yeah, which I think is also important, and this industry is an industry about people, about connecting people. Yeah? As in a world like this, yeah, with a lot of division and now even a war and so on, we are in Siemens Healthineers 66,000 people in 75 countries. Yeah? We have employees in China and in the US, yeah? In Russia and in Ukraine, working towards one common goal. Yeah? And I think this aspect, yeah, of saying, hey, look what is possible. And we also want to be a bit of a beacon to show how one can work together is something which I really think is important. Yeah? And I think not only for the big companies, but I mean for all of us working in this field. Yeah,
yeah, it's true. I agree with you completely. We work in the best industry. The things that we do touch people's lives, can make a difference. There were some practical things that you did coming out of COVID. There was this idea, coffee with Bernd, I think that you had implemented. Sounded fun, but as I talked to people more closely, it was more than just fun. It meant a lot to your teams, and it sounds like something you've carried on.
Yeah, I mean, this is an interesting thing. I mean, when we switched to home office and so on, it was the question how to stay connected. Yeah. And there's one topic which is funny. Yeah? When you are the CEO, you are socially distanced. before. Yeah? Normally, you're put in an office, and then people want to visit, you need to go there, and I need to talk to the secretary, is it okay to order coffee or not, and where should I sit, and or when, Bernd comes, we need to clean up, and so on. I mean, you can be as natural as you want to be. I mean, the title gets into your way, to some extent. And what is really nice in Zoom or Teams, it's very democratic. Yeah, you switch on, you see what's in the back, you talk about, hey, how do you keep contact with your parents who are 80 years old, how do you do this, and so on. You have a different type of discussion, and you are just one of many. Yeah? And it creates less barriers. Yeah, so it was, from that point of view, very nice, but it meant a lot for me to be able to connect to teams in Latin America, Singapore, or wherever. Yeah, it was much easier than before, than announcing I'm going to come. And I think it created a sense of connectedness in a super difficult time. Yeah.
It definitely has had an impact on your staff, and the limited folks that I talked to has had a huge impact. So we have some rapid fire questions that we want to go through. We're coming up towards the end, but before we get to that, I wanted to challenge all the big strategics, not just, I won't pick on you because you're up here, but challenge all the strategics to work with the ecosystem to figure out how we can all do better together. I think some great relationships will be established here, some deals will be done, and hopefully that all translates into technologies to patients faster. What words of encouragement or challenge do you have for the innovators that are here, the investors that are here? What can we do as an ecosystem to move things forward more quickly? I know that's a very high-level question, but...
Yeah. I mean, first of all, I think it is very important that we are not impressed by the current environment. Yeah? I mean, it's clear, it's a different way of looking at capital currently and so on and so on. But this is exactly the best time to make the right decisions, and to not hold back. Yeah? And I think this is one aspect. And I think this, as I said, I think the time for Medtech has never been better. Yeah? When I'm not able to give you the number one priority because I think there are three, it's a good message. Or it shows how much the world needs us. Yeah? So optimism.
Okay, very good. So now's the time. Maybe we can go on an M&A run over the course of the next couple of years, possibly. So I'm going to go into some rapid fire questions here. Biggest challenge you faced thus far as a CEO?
See, I think what is always super difficult is stopping something. Yeah, but it's necessary. Yeah, I mean we have exited certain businesses, and this is always super hard. Yeah, because as an innovator and as an optimist, you believe in it. Yeah, and there's one lesson I learned. Yeah, Bernd, it is a decision, not a conclusion. Yeah, don't wait when you stop something until it's a conclusion, until it's logical, because then it's by far too late. Yeah, but making this, when you have a group of people who are super passionate about something, and you basically say, I don't think this will make it. Yeah. Or that is not the best use. There's other opportunities which are better. This is always the toughest, yeah? And luckily it doesn't happen very often. Yeah?
Right, so don't wait, move, take action. Biggest accomplishment you're most proud of at Siemens?
Yeah, so you say as Siemens or Siemens Healthineers, because I personally don't really like the word pride. Yeah?
Okay.
It gets into your way. Yeah? No, but I think what is... I think what I'm really proud of for the overall team, that that, I mean, you said we are a new company, but an old company with a tradition. But to say, sometimes I say, and people might laugh, yeah, we are the biggest startup in Medtech, yeah. But you know, creating this company as a team to say, and which really, you know, is a new kid on the block in the German index, which is a new category of company worldwide, and standing for a special culture. I think this is what we can be a little bit proud of, as long as it doesn't get to our head. Yeah.
Okay, got it. What's been the biggest surprise that you've seen
In life?
In life, please.
No, wow, that is a big question. Biggest surprise.
Something you didn't expect to happen at Siemens Healthineers that surprised you, that you had to react to. As a CEO, obviously, you get many of these. The biggest one.
The biggest surprise.
Or the funnest one to talk about.
The final. Oh God. Big surprise. Surprise. See, I mean, I'm always in the. So I give a bit of an abstract answer. I think the biggest surprise is always other people. Yeah, and when you what's below the surface. Mm-hmm. Yeah, and this is, I think, yeah. So I would leave it like this. Yeah?
I'll pile on to that. One of the comments that came up from your team was that there's this attitude of bring your real self, bring your genuine self is a culture that you've created. So that's interesting. We'll go to a more simple question. What book is on your shelf right now? I know you're an avid reader.
Yeah, so my shelf is virtual. Yeah, so I'm an audiobook fan. Yeah, so which fits better to my lifestyle. Yeah, so because I can go running or whatever, but I'm always listening to a book. Yeah, which helps a lot. Yeah, to get some different perspectives. But the current one, which I just finished, yeah, I mean, it even fits to what we discussed. It's a small philosophy of the encounter. Yeah, and I liked it. Yeah, so it's the big word philosophy and then encounter. I mean, the encounter. So it is really about how do people get better by encounter, or you know, what life-changing things are happening when you encounter others. So it's a very nice book.
Very good. Okay. Well, I'd like to leave it with something a little open-ended and give you a chance to, again, inspire folks here. The Siemens Healthineers mission is that you pioneer breakthroughs in healthcare for everyone, everywhere. How is Siemens Healthineers doing against those goals, and what can we expect in the future?
I mean, first of all, a word of background to this. I mean, you mentioned the Varian acquisition. I always say combination, and I say combination because this is not, you know, the quote unquote bigger company taking over the smaller ones, because we wanted to be, and we are super respectful. We say, hey, this is a world market leader. They were beating us 10 years ago in radiation therapy when we had to exit, yeah, one of the difficult moments. And they are an older company than us as a public company. Yeah? So, I mean, an all-star team joining us. Yeah? And I said, hey, you are joining us you're joining an all-star team. You are the LeBron James. We are not teaching you how to dribble the ball. Yeah. Mm-hmm. So, but what we wanted to do is also now come up with a joint vision, yeah, or joint purpose, and what Varian brought to Siemens Healthineers is it's much more about the patient, yeah, because it's about cancer care, while let's say the heritage of the, let's say, classic Siemens Healthineers is more on is a bit diagnosis heavy, where you're also a little bit in the second line medicine, yeah, you are catering to physicians who are referred to, yeah? Radiologists, lab medicine, and so on. Yeah. So in this this brought the for everyone, everywhere. Yeah. So the topic of the variant has a super clear vision, creating a world without fear of cancer. Yeah. So and we wanted to embrace this. So this is a little bit of so it's the story of the combined company. And with the for everyone, everywhere, we are very serious about these 3 billion who don't have access to care. Yeah? We have a big top initiative called Access to Care, where we are really focusing on this. How can we democratize our technologies? How can we, with governments, with NGOs, with other companies, create the ecosystem which is necessary to give more people access to the great work we are all doing in this field. Yeah?
Very good, thank you. Well, Bernd, thank you for helping us to kick off this meeting. Please, let's give Bernd a warm welcome, round of applause. We're at exactly 20 seconds, so we're on time in tradition. I'm sure we'll stay on time today, right, AV team? Bernd, thank you.
Okay, thank you.
Thank you.